Dr Travis Osborne, welcome to the show.
Hi, thanks for having me.
So you specialise in helping people that have got anxiety disorders per se. What exactly does your job involve?
Yeah, well, I'm a psychologist, and in my job, I'm a therapist. So primarily what I do is work with clients on a one-on-one basis to teach them strategies and ways of coping with whatever anxiety problem they might be having.
So how did you get into that yourself?
As part of my training as a psychologist many years ago, I started working with people with post-traumatic stress disorder, which is a disorder related to significant life events, being assaulted, witnessing assaults, those kinds of things. And then later on in my training, I worked with other folks with PTSD, mostly veterans, at a veterans hospital. And at the end of my training, got hired at an anxiety specialty center where I now treat the whole range of anxiety-related problems.
Fantastic. And so give us a quick overview, because I know there are various what you might call anxiety disorders, but for anyone listening that might not be aware, they might be able to identify more with some of them if they know more about them.
Absolutely. So there's many different kinds of anxiety, and what we know is as a group, they actually comprise the single largest group of psychiatric problems. About 28 to 30% of people in the world will experience an anxiety disorder at some point in their lives. One of the most common is phobias, so people who are afraid of everything from flying to small spaces to dogs, spiders, so fear of a specific object or situation. Another very common type of anxiety is social anxiety, so people who are very uncomfortable in social interactions, meeting new people, possibly doing public speaking, performance, that kind of thing. Then we have what's called generalized anxiety disorder, which really is a fancy name for worry. So these are folks who spend a lot of time each day worrying about a whole range of topics, maybe work, their health, their families, well-being of people they love, and it's very hard for them to control that worry. Form of anxiety that's very common is obsessive compulsive disorder, or OCD, which involves recurrent and repetitive thoughts or images in the person's mind that are very distressing, and then they feel the need to do a range of rituals or compulsions to make themselves feel safer or more comfortable.
And that was what was featured on Extreme OCD Camp. People may have seen that on BBC Three. I think it was interesting to see how much the people that were on there actually improved within, just a few days. Do you still keep in touch with those guys now?
I do, and they are continuing to do really well. And one of the things that's a good takeaway from that program is that professional help can really help people with anxiety, but they have all continued to fight their anxiety after the help that they received on their own, and there's a lot people can do on their own to fight their anxiety as well.
Fantastic. So what other forms of anxiety are there? Because I know there's a couple more as well.
Yeah, the two other big ones would be post-traumatic stress disorder, as I mentioned, which is fear reactions that develop after and through a very traumatic event, such as an assault, witnessing an assault, being in a war zone, those kinds of things. And then the last remaining type of anxiety is panic disorder, which is very common, where people have recurrent panic attacks where they feel really overwhelmed with fear and anxiety that seems to come out of the blue, and then sometimes might start avoiding all kinds of situations and can become agoraphobic or kind of homebound because of their anxiety.
So do all those types of anxiety, do they all have certain things in common? What are the kind of components of anxiety?
So all anxiety problems have three kind of main components. The first main component has to do with the way that we think. So as human beings, we have the ability to kind of think out into the future and imagine or see threats in the world around us. And so people with anxiety tend to see threat more than other people do. So they overestimate the likelihood that bad things are going to happen. And when we have anxious thoughts, our bodies respond. So we get what we call physiological arousal. We get increased heart rate, faster breathing, sometimes upset stomach. And so we feel physically anxious. And when we're having anxious thoughts and then our bodies get very anxious, the third component of anxiety that happens is what we do with our behavior. And one of the most common things that people do when they're anxious is want to escape or avoid whatever it is that makes them uncomfortable. So we call that avoidance behaviors. But sometimes we can't always escape the situation altogether. So people also do what we call safety behaviors, which is a range of things that they might do in the situation to just keep themselves more comfortable if they can't escape altogether.
So people sometimes get kind of stuck in anxiety because a lot of people may not go and get actual help for it, right. Or they may actually go to their GP and they may not be given the right kind of help. What would you say is the most effective treatment for people that are experiencing some kind of anxiety issue?
Yeah, so anxiety is a place in mental health where we have actually come the farthest, that we actually have the best success with treatments when people get the right treatment. And you're absolutely right that most people actually don't get the right treatment. So there's two main types of treatment for anxiety that have been found to be the most effective in research studies. The first is certain types of medications, specifically the SSRIs. They're called antidepressants, but they also work very well for anxiety. And the type of therapy that's been found to be the most effective for anxiety is something called cognitive behavioral therapy. This therapy has been studied for 20 to 30 years, has been studied with all of the different types of anxiety. And what we find is that people make substantial improvements with their anxiety when they do this particular kind of therapy.
And with CBT, or as it's also known, cognitive behavioral therapy, there are certain aspects of that are more successful at treatment than others, aren't there?
That's true. Yeah. So CBT actually attacks all three of those components of anxiety that I mentioned. Anxious thinking, feeling physically anxious, so physiological arousal, as well as avoidance behaviors. And so we teach people strategies for all three. But the one that we know is really probably the most effective has to do with helping people change their avoidance behaviors. And we do that with something called exposure therapy. And this is actually very well kind of displayed on the BBC 3 documentary about the OCD camp, where we were doing exposure therapy with people with OCD. And in a nutshell, what exposure involves is basically facing one's fears. And I think we all kind of know on an intuitive level that the way to get over something we're afraid of is to do it, is to confront it. But that's obviously a very challenging thing for most people to do on their own.
So what would stop people from actually using it then? Are there reasons why people wouldn't use it? Is it just sometimes a case that they don't have the kind of resources to do it themselves?
Yeah, it's a great question. So I see a lot of people that come into my practice who, when I say we're going to work on facing your fears, they say, well, I've tried that and I'm still very fearful. And typically what people have had the experience of is just pushing themselves to do something that's very scary for them, and then having the experience of being flooded or overwhelmed by anxiety. And so they walk away from that experience kind of feeling like they failed. Often sometimes having to just escape or leave the situation because they're too anxious. The way that we make this more doable in treatment, and also how people can make it more doable on their own, is to think about exposure. We think of it like a ladder, and sort of moving up the ladder from things that are easy to more difficult. So what we do in therapy is we work with people to identify the range of situations that make them anxious, and then we rank order them from kind of those that are easiest to those that are more difficult. And we start with the ones that are on the easy end. What that does is it allows people to practice the skills that they're learning in treatment and kind of build a sense of confidence or build a sense of efficacy that they can actually fight or tolerate their anxiety. And once they've conquered something, then we move up to something harder. So I think the mistake that a lot of people make is they kind of start too high. They push themselves to do something that's really hard. They get overwhelmed, and then they feel kind of demoralized as a result.
And you just talked a little bit about it there, some kind of pitfalls as to why it can work. Are there any other reasons why, or ways that, if people wanted to do it on their own, they thought, right, I'm going to face whatever fear it is I have. Are there things that they could do wrong? I mean, I know you said facing something big first, but are there other things that they could be doing that aren't getting the result?
Yeah, absolutely. So the one thing that we know about exposure therapy for any kind of anxiety is it's all about repetition. You have to confront the same situation many, 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 many times for it to become more comfortable. So one of the mistakes that people will make is they'll push themselves to do something once, and then they don't necessarily feel any more comfortable, and so they feel that it didn't work, and so they stop. So one of the things we know is repetition. You got to do the same thing again and again and again. So for me, I used to have a big fear of public speaking. It took giving many public talks before that finally started to get comfortable for me. It didn't happen with just one thing. Another common pitfall is that people don't do the exposure for long enough. So somebody might go into a situation that makes them nervous or anxious, but then leave after a minute or two. And what we know is that it takes a while for anxiety to come down, and somebody might need to stay in the situation for 20 minutes, a half an hour, or longer to get a reduction in their anxiety. And I think the last common pitfall is just that sometimes people are doing exposure to the wrong thing. So they might kind of think they understand their fear, but maybe they don't understand it as well as they would need to design kind of an effective program for themselves.
So what would be a good starting point for anyone that's listening that may realize that they have some kind of issue with anxiety, and they're not quite sure where to start?
Yeah, so what we always do in treatment is we start with something called self-monitoring, which is having people just start tracking their symptoms. And for anxiety, there's a very basic way to do that. It doesn't have to be very complicated. It simply involves having people write down, sort of keep a log of what are the situations that you encounter during the week, let's say, or a typical day, when you feel anxious. What are you doing? Where are you? And then just starting to tune into the thoughts that you're having. What are the anxious thoughts that are going through your mind? What are the kind of worries or fears that you have? And then what do you do? Do you notice the urge to escape? Do you do something else to make yourself feel more comfortable? And so we kind of talk about this with people, just kind of getting the lay of the land, like get to know your anxiety really well, understand how it works and how it functions is a really good start.
And how would that work for the kind of what-if thinking that can be quite full on for some people, in terms of what if this happens, what if that happens, and maybe that thinking kind of loops over and over, and that in itself could be an issue because maybe the actual thoughts that people are having would not lead to them knowing what kind of exposure to do because the thoughts may not be of a specific thing that they could expose themselves to.
It's a great point. So with worry in particular, we often use a strategy called imaginal exposure. And what we actually do is we have people write out the content of their worries. So let's say someone was very worried about making a mistake at work and losing their job, which is a very common type of worry with people with anxiety. We'd actually have them write out kind of a short paragraph about what are the worry thoughts that go through your mind. And then we'd have the person actually either read or record and listen to that kind of script is what we call it, over and over and over again until those thoughts or images kind of lose their impact. They start to have the same, they stop having the same impact on the individual that they used to. And this can be a very effective strategy for managing those kinds of worry thoughts.
So overall then, what would be your kind of top tips, if you like to put it like that, generally for general kind of anxiety for people to get started?
Yeah. This would definitely be starting to just self-monitor. Keep a log of the kinds of thoughts you have, the kinds of things that make you anxious, the kinds of situations that trigger your anxiety. The next step would really be to really tune into your thinking. What kinds of what-if statements go through your mind? What kinds of negative outcomes are you imagining? The way to challenge those best is anxious people really only tend to think about the worst-case scenarios. And what we know in life is that the worst-case scenario usually is not the most likely scenario. There's usually a whole bunch of other situations or outcomes that are more likely much of the time. And so we encourage people to think about, well, what are all the other things that could happen? You're thinking about the worst case. What else could happen? And then to put your worst-case thinking in perspective. So how likely is that given the other range of things that could happen? But, sometimes the worst case in life does happen, and so we also encourage people to think about and actually write down, if your worst case fear happened, how would you cope with that? What would you do? The reality is that many people, even who are anxious and worry, when actual crises and events happen, they often respond quite well. Their problem is that when they get stuck thinking about things that could happen, they feel overwhelmed. So problem solving, coming up with a coping plan is really effective. Some relaxation strategies can be helpful for people with anxiety. There are several techniques that people can look up. One is called diaphragmatic breathing, which is a way to slow down and kind of regulate breathing that can happen in panic attacks. Another relaxation strategy that's widely used is called progressive muscle relaxation, which is better for folks with chronic worry or tension, stress, that kind of thing. And it involves just kind of systematically relaxing all of the muscles in the body. One of the emerging areas kind of in our field in working with anxiety, it has to do with mindfulness-based strategies. And at its root, mindfulness is kind of the practice of just being in the present moment. And if you think about people who are worrying or doing a lot of what-ifs, their brain tends to be in the future, not really in the present. And so there's a lot of strategies that people can do to practice bringing their attention back to the current moment, and that can be a very effective anxiety strategy as well.
And I know that we've already talked about some of the pitfalls of exposure, but are there any other kind of common mistakes that people make when they're trying to kind of deal with or feeling anxious in some way?
Yeah, that's a great question. Actually, there is, and I want to touch base on this again because I didn't mention it much, and that's something called safety behaviors. And one of the things that happens is when people are anxious, they, of course, start to look for things to make themselves feel more comfortable. Sometimes those strategies are effective and work in terms of breaking them out of the cycle. Sometimes they make them worse. So a good example would be somebody who has panic attacks. Oftentimes people get worried about having more attacks, so they start doing things like carrying their cell phone with them so that if they had an attack, they could call for help. or maybe carrying an anxiety medication with them in case they needed to take it quickly if they were having a panic attack. Other people will carry water with them, those kinds of things. Those objects become what we call safety signals or safety behaviors. And although they make the person feel more comfortable in the moment, they actually tend to escalate fear over time because the person comes to believe that the only reason that they're safe is because they have those objects with them. And what can happen over time is if the person doesn't have those objects with them, they find it very hard to function, but they often then need more and more and more of those safety cues with them in order to be functioning effectively. So that's definitely something for people to look out for because it's a very normal human instinct but can really backfire.
So it's really about the awareness coming first, and then once you notice you might be doing it, then work on doing without that support object or even a support person, because sometimes they can, want to be around certain people as well.
Exactly. And so it's such an easy habit for anxious people to fall into, but it can really, it's kind of like quicksand. It's kind of the more you do it, you actually get more and more pulled into the anxiety problem.
And we touched a bit earlier in the interview on SSRIs, antidepressants, as being a medication that people can use. Is that something that you recommend, or do you think that could also be seen as some kind of safety thing?
The SSRIs actually tend not to be seen as a safety thing because they're a very long-acting medication. So they take several weeks up to a month or more to build up in the body and to be effective. And so people don't get an immediate sense of relief when they take them. There's another kind of anxiety medications called the benzodiazepines. These are things like that work very quickly, that if you take them within 15 to 20 minutes, you feel better. They can be a really important part of treatment for some people, but those medications have a much higher risk of becoming a safety behavior because they work immediately, and people can feel like they have to have them in order to function.
And so for the antidepressants, which I think are quite widely prescribed over here, certainly for anxiety, is that something that you would kind of recommend for people to go down that route, or would the CBT route be more effective, or are they about the same?
Well, in general, the research shows that CBT is more effective in the long run. One of the problems with medication is that if people sometimes stop taking it, you see a higher rate of relapse when people go off medication than you do when they've done CBT. And that makes a lot of sense because in CBT, people have been taught the strategies that they need to manage their anxiety over time, whereas with the medication, they do not. I usually recommend that anyone with kind of anxiety on the moderate to severe end at least try an SSRI in conjunction with therapy, because often the two working together, you get even better results. And then frequently, many people with anxiety are able then to taper off medications at some point, although some with more severe anxiety just may need that little bit of extra help biologically over time. For people with more mild anxiety, I would say typically try CBT first, even try self-help-based CBT first. People can often, just with the right tools, make a significant amount of progress and can avoid, having to go on medication altogether. So
really, people don't necessarily always have to get help from other sources. They could start themselves by doing simple kind of exposures on a gradual scale, and they could actually begin to see differences.
Absolutely. One of the great things that's happened in our field in the last 10, 15 years or so is people have started publishing the treatments that we know work the best for things like anxiety and depression. So there are now tons of cognitive behavior therapy, CBT workbooks that are available for people to use at home, either with or without a therapist. And there's even some research to support some of those that they are effective even if people are not working with a therapist. And so there's a lot people can do to start the process of learning those skills, and many people might find that enough is alone. If it isn't, then that's a good point to start talking to a GP or start talking to a therapist or finding a therapist if you're not able to kind of quite do it on your own to the level that you would like.
Fantastic. Well, we're going to be talking over the next few months on covering all the different anxiety disorders in more detail.
Yes.
But for the moment, Dr. Travis Osborne, thank you very much.
You're welcome. Thank you.